Today we are going to talk about some of the issues that tend to plague riders in terms of shoulders and arms and a little bit of the wrists. So the riding position that we have on the bike, whether you ride upright or down forward or whatever it is, whatever kind of bike you ride, whether it's a cruiser, an adventure bike, dirt bikes, whatever, your locked in position is with your arms kind of forward, which can put a little bit of an impingement on this axillary nerve, on the brachial nerves that go down here. We also get a lot of tension on our neck from riding with a helmet. So there's all that wind shear and your neck takes the brunt of that. And the discs, the vertebral discs in your neck, can get really stressed from that. So there are a lot of reasons that you can have neck pain, shoulder pain, arm pain, numbness, tingling, things like that. Not the least of which is carpal tunnel syndrome, right? Carpal tunnel syndrome, because we're throttling continuously or braking, having our hands kind of in a locked position on the bike can also be a problem for riders. And so I'm not here to diagnose all of the things that might be wrong with you, but I'm here to just give you a couple of stretches and some things that you can do to help combat maybe some stiffness, some shoulder pain. So I want to talk just for a second about nerve glides. So there's a lot of information out there on the internet about different nerve glides that you can do. So let me just explain really quick. The nerves kind of go through the muscles and the fascia, and if this is your muscle and your fascia, then the nerve wants to be able to glide along those tissues, right? The nerves want to glide, but if you've got tight muscles, if you've got tight fascia, then sometimes they get stuck and adhered. And so then they don't move, and then when you try to stretch or lengthen out those muscle fibers, it pulls on the nerves, and nerves don't like to be pulled on. So what you can do sometimes is what's called nerve glides. And like I said, there are several that you can find online. For carpal tunnel, for example, you can just move your hand up and back. Not a stretch at the same time. You want to stabilize one end of the nerve and then just gently work the other part of the nerve through a range of motion that opens up this carpal tunnel area in the wrist. So just doing some simple stretches and then release. It's not uncommon to have some numbness and tingling in the area that you're stretching while this is happening. It shouldn't persist, but pain probably not. So kind of like when you are asleep or if your foot falls asleep and you had a lot of compression and then all of a sudden you stand up and that area gets flooded with fluid and blood flow, the nerves kind of wake up and get tingled. They were compressed, and then when they get blood flow and that compression is released, you feel that sensation, that paresthesia. And so sometimes that is normal, okay? Another one you can do, I'll just move over a little bit here, is to move your arm back and forth. And so moving the thumb and the hand in different ways. So again, you can look a lot of these up, and there are physical therapists and things like that that will explain a lot more. But some nerve glides and some shoulder range of motion, right, is going to be really important.